We want to take a look at reinventing yourself at any age. All this week we've been doing that. And yesterday, as you know, we introduced you to a woman who had breast implants, and that was at the age of 80. But on this morning's Healthy Woman, the other end of the spectrum, facelifts, and those having them at younger and younger ages than ever before. This is the face of the modern facelift.
I don't see this big crease that I used to have in here, like it was very definite.
You had a real furrow.
I could see it, and I did not like it.
Pamela Holthouse, a real estate broker from Florida, had a mini facelift a few months ago, and she's only 35.
Before I had the surgery done, my family and my friends said, "You're absolutely crazy. You look great. What small amount of wrinkles that you have is normal, natural, and it doesn't take away from your looks." But for me, I wanted to look better.
With a mini facelift, the difference is meant to be subtle.
There's actually almost real jowling there.
And in Pamela's case, it was. This picture was taken before the surgery. Take a closer look. Before on the left, after on the right.
Nobody noticed?
No, no one.
So why'd you bother doing it?
I want to do it for myself.
Over 124,000 people get facelifts every year, and even though non-surgical options like Botox and collagen are becoming increasingly popular, Dr. Pamela Lipkin says she's seeing more and more women in their 30s looking for a little nip and tuck.
Collagen to fill out the wrinkles, fat injections to fill out a furrow. But at the end of the day, what they're doing is they're filling out looseness. And the best results come when you don't puff out the looseness, but you take that looseness and you get rid of it. The incision starts about here. It's placed in a natural fold. That's very unlikely to be seen. You take the skin, redrape it, and the excess is gently trimmed as a perfect fit around those incisions that are very well hidden.
Darla Shine is also 35 and also thinking about a mini facelift. She says gaining and losing 70 pounds during each of her 2 pregnancies made her feel uncomfortable about the way her face looks now.
Well, I just feel like I look tired all the time, you know? My face is fatter, it's hanging down, I look tired, I just don't look the way I used to look.
To see how she would look after the facelift, Dr. Lipkin makes her lie flat on her back.
When you lie flat, all that sagging through here, even the little bit of skin in the neck, even the slight jowl, all moves back from where it came. This would be your result. No more and no less. If you have somebody who's unhappy, feels ugly, and they think a facelift is going to change all of that, you should stay away from those patients because no matter how good the result is, that person still won't be happy.
When those people say to me, you know, you're crazy, you look fine, that's great, but I could look better.
Well, Darla Shine joins us now, and so does Dr. Pamela Lipkin. Good to have you both with us. Darla, can the camera go in really close on you right now?
Wait, which camera?
Just look into this camera right here.
You can
what
see
are
the
you
gizzard.
seeing?
Well, to you, you may think I look good, but
I
if
do.
you saw the way I looked before I had the children, you know, if you saw my face, you know, 7 years ago I looked a lot different. My face was tighter. Now I feel like it's all hanging down. I have a gizzard growing. And why do I have to have that? With the technology they have, they just tuck it right up, pull it back a little bit.
Does your husband think you're crazy?
He thinks I'm crazy.
Yeah, your friends think you're crazy.
They think I'm crazy, but I have to do this to make myself happy.
All right, Dr. Lipkin, is there any obligation you have when someone looking like this walks in to say, no, just don't, you know, surgery is still surgery, don't do it?
Well, actually, this is very minimal surgery. It's really not a reinvention of the person. Nobody would really notice much of a difference in Darla's face except Darla and maybe myself. So maybe these things should be kept secrets. But
too late.
The obligation is that you have to identify whether the person is really unhappy about the actual aging change. If that's identifiable, you can see it, you know you can correct it, and that's what the person is upset about, then that result will be good.
And you're talking about very small procedures, right?
Well, these are very, you know, it depends on how aged the person is. In Darla's case, it would be extremely minimal. A week of healing, minimal incision, And basically, it's an anti-aging technique. I mean, now the focus is not on waiting till you're aged to reverse it, to go forward and move back, but it's to nip it in the bud, take the looseness that's starting to show, get rid of it, and it actually prolongs the life of the facelift.
How many times can you do this in the course of a lifetime? 10?
Well, I've done some of these mini facelifts 15 years ago, and those patients have not come back for full facelifts. They come back in 15 years, 14 years to do another mini facelift. So in a way, this anti-aging technique does work and ward off further aging changes.
And you have said that you believe that women who get them at this age, because they're so small, are happier with them than women who wait and get the real thing later on.
I think that patients who have the early aging changes can get rid of them as if they were never there. When patients wait till they're 50, 55, they expect a miracle, and miracles are not happening.
But does it make you sad, Darla, that
when I look in the
can't just
mirror,
be
I'm sad.
No,
Yes.
you can't be just pleased with the way you look.
Well, I am pleased with the way I look. I mean, I don't want to sound like I'm completely insane. I'm not getting a major facelift. It's just that this area here, I feel, when I look in the mirror, I'm starting to look older, and I'm starting to look like a tired old housewife. I'm at home with the kids, but I don't want to look this old yet, you know? I look tired.
And I
feel
know
like
it's your job, Dr. Lipkin, but do you ever look at this universe of people trying to change themselves physically and say, something's wrong here?
When people want to use this technique to change themselves, I stay away from those patients. Darla wants no change. She wants to go back to the way she looked 5 to 7 years ago. She just wants to slow the clock back, reverse it when she was happy.
All right. Will you let us see after you've done it, if you do it?
Yes.
All right. Okay. Well, again, I thank you both.
Hopefully you won't be able to tell that much.
That's the point, I guess. That much. You just look like you had a great weekend, right? All right. Thanks to you both.
Thank you.
Good to have you here. We'll see you again.